Hi, my name is Nancy Bartlett. Today is November 1st of 2025. I'm here to do a video recorded health history. I'm gonna turn this camera around real quick and show you the spot where we are. If you're wondering where we're at, this is what a cath lab looks like. We're in the monitor room. Back to where we started. You can see the ceiling. And you can see the floor where we're at. I do have my papers that have a couple of notes on them for history taking that we were allowed to have for this time. Like I said, again, today is November 1st, 2025. My name is Nancy Bartlett. I am a family nurse practitioner student at United States University, and I am here for a recorded health history. Do I have your permission to record you?
Yes.
Okay, great. We're gonna get started, okay? Could you please tell me your name and date of birth?
JB, November 25th, 1966.
Great. And how would you prefer that I refer to you as?
JB.
JB. Okay. JB, in today's society, pronouns are really important to us, and I refer to myself as her and she. How do you prefer to refer to yourself as?
He and him.
Okay, great. And what brings you in today?
Wellness check.
Okay. Everything been going okay? Any
Great.
problems?
No problems.
Okay. Any concerns or ongoing issues since your last visit?
No.
When was your last visit?
Last October.
Last October. Okay, great. And then since then, any dental issues? Have you had a routine dental checkup?
In August.
In August, okay. And no problems,
Nope.
nothing broken, nothing that needs addressing?
No.
Okay. Do you wear glasses or anything?
Yes.
When was your last vision exam?
Last September.
Okay. And any issues there that you can share with me?
No.
Okay. Your last physical, did they do an occult stool test?
Yes. It was fine.
Okay, perfect. And have you yourself been diagnosed with any health issues like high blood pressure, diabetes, high cholesterol?
No.
No migraines, nothing like that? Healthy guy, huh?
Right.
All right. Have you ever been hospitalized?
When I was 8,
Well, can you tell me about that hospitalization?
yeah, I had an appendectomy.
Okay.
I stayed in the hospital 2 days, I think, then they sent me home.
Okay. And so at age 8, that would have been what, about 1973? Okay. And any complications with that procedure?
No.
Any problems with anesthesia that you can remember or that you were told of?
No.
Okay. Any other procedures?
I had a 2010 surgery on my right knee for a torn meniscus.
A torn meniscus. Okay. And no complications after that procedure? Full
No.
recovery?
Yes.
And no problems with anesthesia?
No.
Okay. Any other surgical procedures that you can think of?
Colonoscopy.
Okay. And when was your colonoscopy?
When I turned 50.
Okay. And do you know the results that you can share of that?
I didn't have any polyps or lesions,
Okay.
so I got a very positive result.
Okay. When did they tell you your next follow-up would be?
They didn't really give me a specific follow-up.
Okay. Okay. How about your immunizations? What can you tell me about your childhood immunizations?
I had them all.
Okay. And as far as you know, they're all up to date?
Measles, mumps, polio.
Okay. How about the COVID vaccination?
I got the shots for COVID at the height. I did the regimen.
When you say height, you mean at the height of the COVID outbreak, so
Right.
in 2020?
Right.
Okay. And have you had the booster since?
I did.
Okay. When was your booster?
September.
Of this year?
Mhm.
Okay. And how how about shingles vaccine
When I was 50.
when you were 50? And did you receive 1 or 2 vaccinations for it?
I think it was just one, but I don't remember.
Okay. Well, we may need to check on that just because shingles vaccine is normally 2. And so if you've only received the 1, we'll want to make sure that we follow up with that. How about the pneumonia vaccine?
I have had that.
Okay. When did you have the pneumonia vaccine?
October
October of this year.
this year.
Okay. And how about the flu vaccine? Have you received that?
That was about a week ago.
Okay, great. Sounds like you're staying pretty on top of everything. Great. Do you take any medications?
No.
No medications at all. Do you, so no prescription medications?
No.
Okay. Do you take any herbal supplements?
Mm.
Any multivitamins?
No.
Anything over the counter?
Tylenol.
Tylenol. Okay. Do you know how much Tylenol you take?
When I take it, which is not often, I usually take a tablet or 2 of 500 milligrams.
Okay, so 1 to 2 tablets of a 500 milligram. When's the last time you had to take Tylenol?
About a month ago,
Okay.
I was sore.
Sore? What had you been doing?
I was just outside working.
Okay. So that's not uncommon for you to have just a few, okay, soreness, aches and pains.
Doing something different.
Okay. Sounds good. Can I ask you about your family history? Would you mind sharing some of that with me?
Okay.
Okay. Do you have children?
Yes.
You do? Can you tell me about your children?
Well, I'm remarried, so there's 6.
Okay. Tell me about your biological children.
I have a 26-year-old daughter and a 24-year-old son.
Okay. Not that I'm discrediting your whole family because I think it's great that you are a blended family, but genetically we want to look at your biological children. Are your biological children healthy?
Yes.
Okay. Never been diagnosed with any kind of concerns or anything? No high blood pressure, no high cholesterol? Okay. Can we move on to siblings? Do you have any
A
siblings?
sister.
A sister. How old is your sister?
61.
61. And is she in relatively good health?
Yeah, not bad.
Okay. Does she have any like high blood pressure, high cholesterol, diabetes?
Juvenile diabetes.
Oh, okay. When was she diagnosed?
16.
16. Okay. So she's had that quite a while, huh? And she's doing okay, no problems?
Well, she has her ups and downs.
I'm sure. How about your parents? Can you share with me about your parents?
Father is deceased. Mother is still alive.
Okay. How about your dad? Did he have any health concerns? Any high blood pressure? Any high cholesterol? No history of cancer of any kind? No thyroid issues? Same with mom?
Mom's healthy.
Okay. How about grandparents? Let's start with your dad's dad's family.
They're both deceased. His father passed away in his late 70s, and his mom passed away in her mid-80s.
Okay. Do you know any of their family history? Would they have had any like high blood pressure, high cholesterol, cancer?
No, not on that side of the family.
Okay. How about on your mom's side of the family?
My grandfather lived to be 76. He didn't have any health issues. My grandmother lived to 80, and she had high blood pressure.
She had high blood pressure. Okay. Do you know when she was diagnosed with high blood pressure?
Oh, 52.
Okay. All right. No other health concerns? No one else has cancer in your family or anything?
No.
That's fantastic. You guys have healthy genes, right?
Right.
Can you tell me a little bit more about yourself? What do you do?
I'm retired.
You're retired. What did you used to do before that?
I was a principal.
Oh, so what level of education do you have?
I have 2 master's degrees.
Great. And when did you retire?
About 5 years ago.
About 5 years ago? Okay. And have you always lived in this area or are you from somewhere else?
I'm from New York.
You're from New York. Okay. And where were you born?
Watertown, New York.
Awesome. And you mentioned you're married. How long have you been married?
20 years.
20 years. That's really great. do you feel safe in your relationship at home?
Yes.
Yeah. Are you the two of you intimate?
Yes.
Do you ever have sexual partners outside of your relationship?
No.
Okay. So,
Monogamous.
okay. Good to know. Have you ever been concerned about pregnancy or preventing any kind of sexually transmitted diseases?
No.
No. Have you ever, the two of you ever been tested for sexually transmitted diseases?
Yes.
And can you share the results with me?
Negative.
Great. How about tobacco use? Do you use any kind of cigarettes, any kind of chew, any kind of vaping?
No.
How about alcohol? Can you tell me about your alcohol use?
Occasional beer every now and again.
Okay. When you say occasional, what does that mean to you?
A couple a month, maybe.
Okay. And what are you drinking?
Mick Ultra.
Okay. So a couple a month, like a couple at the beginning of the month, a couple in the middle of the month, a couple at the end of the month, or all of it in between, or I guess I'm looking for a little clarification. What a couple means.
I might have a weekend where I'll drink a couple, and that's about it.
That's about it. Okay, gotcha. So, how about caffeine? Can you tell me about your caffeine use?
Yeah, I get up and make coffee every day, so we drink a cup for breakfast.
Okay, and just one cup, like an 8-ounce cup, or
12 or 16.
okay. All right. And do you consume any like energy drinks or anything like that too?
Oh yes.
Okay. How often are you having energy drinks?
A couple times a week.
Okay. Is that kind of normal for you, or okay?
Kind of normal.
Okay. And how about any kind of recreational drugs like marijuana, anything like that?
No.
Okay. And have you ever used anyone else's prescription drugs?
No.
And I don't know if I asked, but do you feel safe at home?
Yes.
Do you feel safe in your relationship? Okay. And have you ever been part of the military?
No.
No. Okay. Your home, do you rent? Do you live in a home, in an apartment, in a mobile home?
We own our house.
Oh, okay. Great. And can you tell me a little bit about your meals? What do you do for dinner, for lunch, for breakfast, all that?
Try to be relatively healthy. Stay with the white meats, fish, chicken, turkey,
Okay.
veggie, salad, a small amount of carbs. You know, a little bit of protein, a little bit of carbs.
Okay. When you say a little bit of protein, how much protein do you think you're eating a day?
Probably 4 to 6 ounces of protein.
Okay, good. Very good. How about your physical activity? Can you describe what a normal physical activity would include for you?
I probably walk between 1 and 3 miles every day walking my dogs.
Oh, you have dogs. How many dogs do you have?
3
3? What kind of dogs are they?
Aussie Doodles.
Oh, sweet. So do you do anything else outside of just walking the dogs for physical activity?
I go for walks.
That's pretty much what you do is walking. Okay.
Yeah.
All right. How about your sleep? Can you tell me about your sleep?
Solid. No issues.
No issues? You feel rested?
Mm-hmm.
How many hours of sleep are you getting a night?
7 to 9.
Pretty good. How about your spiritual affiliation? What can you tell me about that?
I'm Methodist.
Okay. So what does that mean to you?
Just that if something were to happen to me, you know, I want somebody there.
So are you pretty active in a church here
Yes.
locally?
Mhm.
Okay. All right. Does your spiritual beliefs, would they ever have any kind of impact on your health care?
No.
Okay. And when you're driving your car, are you always wearing your seatbelt?
Yes.
Are you texting and driving?
No.
Okay. And how about sunscreen? Are you using sunscreen when you're outside on those long walks?
Yes.
Okay, great. How about firearms? Do you have any firearms in the home?
No.
Okay. How about your daily activities? Are you able to dress yourself and clean and do all the necessary things at home without any problem? You don't have to hire somebody to come in and do that? Okay, sounds good. So Really, the next few questions that I have to ask you, they're basically yes and no questions. But before we move on to that, do you have any questions or concerns for me up to this point?
No.
Okay, so let's go ahead and move on. I'm just going to ask you a whole bunch of questions. Like I said, the majority of them will be yes or no questions, okay? Any fever, chills?
No.
Okay. How about any kind of fatigue or unexplained weight loss,
No.
weight gain?
No.
Okay. How about any changes in your vision?
No changes.
Okay. How about any eye discomfort, eye pain?
No.
No. How about any spots or floaters?
No.
Okay. And you haven't noticed your vision kind of becoming more tunneled to like a pinpoint? Okay. Any hearing loss?
No.
Okay. How about any sinus problems like nasal drip or post-nasal drip?
No.
Any sore throat? How about any head injuries in the past? Okay. Any frequent colds? No. Hay fever? Okay. How about bleeding gums? And you said no dental issues, nothing is in disrepair, nothing, anything missing?
No.
Okay. Have you had any chest pain?
No.
Any palpitations? Any sensation of fluttering? Okay. How about swelling? Have you noticed any swelling perhaps in your legs or your feet?
No. My legs, good. My feet are good.
Okay. How about shortness of breath?
No.
No. Any cough?
No.
Wheezing?
No.
Okay. How about nausea?
No.
How about any change in bowel habits like constipation or diarrhea?
No.
Okay. How about urination? Any burning or pain with urination?
No.
Any change in frequency?
No.
And stream?
It's fine.
Okay. How about discharge? Have you noticed any discharge?
No discharge.
How about nighttime urination where it's waking you up at night?
No.
Okay. How about any joint pain?
No.
How about stiffness?
I get stiff and sore after exercise.
Okay. But nothing that's
No.
okay. Like it's not soreness, stiffness that's waking you up at night.
No.
It's always from physical exertion.
Correct.
Okay. Any back pain?
No.
Neck pain?
No.
How about changes in range of motion?
No.
Okay. Any rashes?
No.
Itching?
No.
How about moles? Any new moles?
No.
Any changes in moles, like changes in shape, where they're irregularly shaped or?
No.
Okay. Any headaches?
No.
Dizziness?
No.
Tingling?
No.
Okay. Haven't noticed any lumps or anything anywhere?
Not that I've seen. No.
Okay. How about any excessive thirst?
No.
Intolerance to heat or cold?
No.
Any excessive sweating? No. Any anxiety? Depression?
No.
Mood changes? Okay. How about any seasonal allergies?
No.
No. No issues with your immune system that you have noticed? Okay. No easy bruising, no easy bleeding, and you haven't noticed that you're anemic of any kind? Okay. Before we finish, is there anything else that you would like to share or discuss with me? Do you have any questions or concerns?
Good.
All right. Well, that concludes our interview. Thank you so much, Jamie, for coming in and letting me interview. I really appreciate it. Thank you.